As a society, not just healthcare, we should be attempting to improve the health of the population. We ought to be doing more than just providing healthcare services. We ought to be, as a society, trying to improve the health of the community.
The whole idea of health has been around for quite some time, but really only in the last maybe 20 years has you seen a big movement away from just trying to take care of people in a hospital or in their doctor's office. What we try to do through Healthier Communities is go to the residents, go to the schools, go to where people are.
We utilize a model that employs community health workers. This is our frontline staff. These are individuals who are from the communities that we serve.
They make a difference in everybody's lives every day, and you just can't put a price or value on that.
I live in the community and I work in my community, and so I get to see the fruits of my labor in my own neighborhood.
What we do is we look at the risk domains that each family, so those barriers that each family has, and for each one of those barriers we have different interventions, different education, different resources that we may be able to connect them with.
We navigate systems, we navigate policies have consequences in the individual lives of people, so part of the job of community health workers is also actually identifying what are those barriers and try to create collaborations in the community in order to overcome those barriers and improve the lives of everybody here in our city.
The fact that we've worked throughout the community in partnership with many organizations to bring change to help the underserved has been outstanding, and we continue to work on these partnerships.
Improving the health of the community is a shared responsibility of the community. It takes a lot of actors and players in the community because you're changing culture and social determinants.
So we are tying people into transportation. We're tying people into affordable housing, offering alternatives for secure meals and food sources.
We've always, from the beginning of Healthier Communities, believed in doing good and assisting the community. But we've decided as a group that doing good is not good enough. We need to measure the contribution to the communities. Does the community, in fact, get the appropriate return? Are kids being educated? Are we spending the dollars in the right place? Are we reducing infant mortality? Are we reducing ED visits? Are we reducing trips to the hospital? Those are the kind of things we look at that tell us we're really making a difference. If we don't measure those things, we do a lot of work, but we can't tell that it's making a difference.
I think as an organization, Spectrum Health is committed to making sure that we keep people healthy. We get into the homes, we get into the whole social fabric of what makes up health of an individual. And I think really we are just beginning to touch enough people in this community and beyond.
What we do with our programming is we try to allow the creation of a map and a direction, and we walk the journey with people. We don't carry them. Instead, we walk side by side.
Building the relationships with our clients is really about not judging them where they're at. When we go into their home, we understand that they're welcoming us to their private space.
I believe when you look into a person's eyes, you can see where they're at. You can see if they're hurting or, so when they look into your eyes, they see that you care.
And the greatest thing of all is each one of them has such great strength within themselves, and a lot of times just us awakening their greatness.
Seeing that you have helped someone to overcome a barrier or overcome an obstacle that has been in their way, that's the best part to me about being a community health worker, is that I'm able to impact that. And when you're able to impact a person's life, to me that's a blessing all by itself.